In this video, I'm going to give you a comprehensive review, causes and principles of treating your lower back pain. Hey guys, it's Maurice here from maurice.fitness.com. Whether you play sports or just with your kids in the park, on this channel I show you how to regain your health through movement, rehabilitation and fitness, helping you lead a better and pain-free life. So lower back pain often occurs as a result of repetitive load rather than a single injury. Non-specific lower back pain refers to back pain with no diagnostic cause. In contrast, specific lower back pain conditions are a rarity, approximately only 5%. At least 80% of people will get lower back pain at some point of their lives. Of those 80%, a very small percentage is actually of the dangerous or life-threatening kind, such as the diseases I will briefly get into. Guys, this is a huge, huge topic and in my opinion deserves the most respect out of all the major orthopedic conditions that plague humankind. The pathophysiology of non-specific lower back pain? The short answer, we don't know. Back pain, particularly lower back pain, is the most common form of pain. Back pain is usually caused by the way bones, discs, tendons, muscles, and ligaments interact and is often due to a fall or injury or other medical condition. Symptoms include pain, spasms, and/or stiffness in the back, tingling, numbness in the legs or feet. I have not seen anybody in my practice, young or old, even if they came to me for any other reason besides back pain, not have symptoms of lower back pain. Meaning, if they come to me for a shoulder, a knee, or a chronic condition, they will or have experienced lower back pain at some point in their life. If you can find a single exercise that can fix all that without a history, please leave a comment below because I'm all about learning. It is important to have any form of back pain checked out by your doctor first. You know, the 5%, to rule out serious stuff like cancer, prostate, even kidney problems. In women, this could also mean that pain could be referring to the lower back or hip with gynecological diseases in cases such as endometriosis, cervical cancer, ovarian cysts. But in these cases, additional symptoms could sometimes, but not always, include bloating, swelling, tenderness and pain around the stomach area. Infections, weight gain or weight loss could also be common. Could it perhaps be a chemical pain, an inflamed muscle or some arthritis perhaps? Ankylosing spondylitis is a type of arthritis of the spine. It causes swelling between your vertebrae, which are the discs that make up your spine, and in the joints between your spine and pelvis. Ankylosing spondylitis is an autoimmune disease. This means your immune system, which normally protects your body from infection, attacks your body's own tissue. The disease is more common and more severe in men and often runs in families. Rheumatoid arthritis is an inflammatory form of arthritis and can also be classified as an autoimmune disease that causes joint pain and damage. Rheumatoid arthritis attacks the lining of your joints, the synovium, causing swelling that can result in aching and throbbing and eventually deformity. In some cases, this affects the lumbar spine. Should we start looking at nutritional solutions? Disc tears, compressions, and herniations. Spondylolisthesis, normal wear and tear, makes it hard for your joints and ligaments to keep your spine in the proper position, especially as we age. When a vertebra moves more than it should, it can slide forward and on top of another vertebra. When this happens, bones can press on the spinal nerves and cause lower back pain. Vertebral fractures caused by osteoporosis, another one, brittle bones. And if you think it's only the elderly that suffer from osteoporosis, think again. Young people can also have osteoporosis due to poor nutrition and drug abuse, especially those with eating disorders such as anorexia nervosa or bulimia. Spinal stenosis, a narrowing of the spine around the spinal cord, can put pressure on the nerves. The narrowing is typically caused by bony spurs that have developed as a result of osteoarthritis. If you want to see any of my previous videos where I talk about the hips and the knees and osteoarthritis and how to prevent that, the link's in the description. Scoliosis, an abnormal curvature of the spine, can also be a form and cause lower back pain. Okay, so why do we look at posture? Well, it's simple really. We're looking at the way you carry yourself during the day, the way you move, bend, lift, and even sit. This tells me a story of the person I'm seeing, a sort of snapshot of this person's history, I can tell you just by looking at someone that this person sits a lot, stands a lot, had a previous injury, or just has a few bad habits, like standing on one leg, like the most of us. Because movement is behavioral, your emotional state can also manifest itself in your posture, static or dynamic. Just look at somebody that is depressed or happy or tired or in a hurry. Does this make you think just how deep this rabbit hole actually goes? Look for any signs of asymmetry, a shoulder or a hip that might be higher or lower than its opposite. How about your lumbar spine? Is it flat or excessively curved? Or the rest of the spine? What about dysfunction? This is probably one of the most important factors on my list, just because we are humans first and we have to live inside our bodies every single day. We need to have this freedom to move as we please and not feel that we're being slowed down by pain and stiffness. So how do we become dysfunctional? Our bad habits. It's what you do to your body day in and day out. Think about that for a moment. I don't know you better than you know yourself. You need to know what it is you do every day that can lead to lower back pain. And think more carefully about your habits. Have you had any previous injuries? Are there simple things you cannot do, like put on your shoes with relative ease? Or maybe sitting on the floor in a squat or legs crossed has become nearly impossible or uncomfortable. If I was treating your lower back pain issues and nothing that I do has any effect on the outcome, I'm going to think, I probably suck at what I do. But if I start making you aware of yourself first and how you treat your body during your day, you might just get some clues as to what the real problems are. What you view as weakness may just be muscle inhibition. Your weakness of a prime mover may be due to a dysfunctional stabilizer. Poor function in an agonist may be due to problems with the antagonist. Your muscle tightness may be protective muscle tone, guarding, and poor muscle coordination. And your low general fitness may just be extra metabolic demand produced by bad neuromuscular coordination and compensation. Normally, physiotherapy targets the tissue physiology and not the motor control problems. Commonly, the exercises are directed towards the area of pain and dysfunction. But this doesn't mean the motor control or stability will automatically reset. And we also know that pain affects motor control. We need to check function. You need to look at just how much compensation there is due to your pain or injury. And you need to choose exercises based on the movement dysfunction and not on the pain or diagnosis alone. And so for this, we need 3 basic principles of movement practice: mobility, stability, and motor control. I'm sure we all know what mobility is, but for those who don't, it's the basic mobility required within each segment of a movement pattern. And without mobility, there can be no real stability. What does that mean? Mobility comes before stability and even strength, because stability is not strength. Stability is your postural control at the start and end of a movement. If looking at your spine and hip complex, it's about timing and not strength. Fine-tuned control and not force, but coordination. Motor control is the understanding of neural, physical, and behavioral aspects of movement. It's the glue that sticks all of this together. There is a host of muscle systems that can get broken down in what constitutes stabilizers, mobilizers, but this video would be too long, and frankly, I feel like I'm boring you already. The things you do without you really knowing you're doing. We need to see just how much compensatory behavior you picked up along the way. Inefficient breathing, anxiety, and high threshold strategies like rigidity in your hips and spine, as well as anywhere else in your body. Lack of reflexive behavior. As you well know, your body is connected to everything else that could be going on inside. First up is the wall squat test. Stand with your toes 10 centimeters from the wall, hands above your head, touching the wall, arms straight. Now slide down slowly into a squat until your bum is lower than your knees. Now look and feel the following: shoulders, upper back, lower back, hips, knees, ankles. Was there any pain? Did you compensate? Now score yourself. Now stand with your back up against the wall, heels 10 centimeters away, arms up at your sides, fingers facing the ceiling. Keeping your lower back flat against the wall, now slide your hands and elbows up above your head without losing contact with the wall or arching your lower back. Score yourself. Now lie on your back, arms to the side and legs straight. Keeping your legs straight, lift one leg as high as you can and don't bend the knee. Look for a 90-degree angle between your hip. There is no magic bullet or quick fix exercise for rheumatoid arthritis, or there's no quick exercise fix for for ankylosing spondylitis or herniated discs, the fix is all about the principles of movement. Maintain good mobility in your hips, ankles, and thoracic spine, whichever way you can, and relearn the basic human fundamental movement patterns. For example, developmental patterns like breathing, back bridges, rotations, correct for asymmetry, allow for reflex and stability, then add the strength, and you will be pain-free. If you found this video helpful, guys, please leave a thumbs up and hit the subscribe button and notification to see more of these videos. And if you're looking for a program, head over to morrisfitness.com and check out the Foundations program, where I go through step by step everything that we've talked about in my previous videos and this video today. I'll see you soon.